so moving on now to our muscle test. Rectus Femoris, we'll just go through that one again. So Neil, if you just like to come towards the edge of the bed here. With that arm, just hold on to the edge of the bed just so they feel stable. I'm here to make them feel like they're not going to fall off the edge. I'm going to work on this leg here. So what I'm going to ask you to do is just to take that leg off the edge of the bed. We're going to be working the muscle on the front of the thigh here. So what I'd like you to do is to raise your knee up into my hand until you feel my hand. That's it. So coming into flexion. This hand's going to come down towards the end of the ankle. And if you just straighten your knee until you feel my hand, that's it. Just pause it there. I'm going to push down here and down here, and you're going to keep it here, keep it in that position. Okay, and just start to resist for me. And resist, 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 and relax. Okay, move yourself back in. Next up is Sartorius. This is our long talus muscle from the outside, from the ASIS, all the way across to the pes anserinus on the medial and posterior edge of the tibia. So right the way across, the longest muscle we've got. So therefore it's going to flex and rotate and abduct. So we've got to try and do all three of those things to muscle test it. Okay, so Neil, what we're going to do is we're going to bring your knee into this position here. I'm going to have my hand on the inside. Remember, don't grip them. So you're going to have your hand here for adding your rotation. And this side is going to come up on top. Positioning of the elbow is important, as Neil highlighted. So just raise your leg up for me. So we're going to push, you're going to pull your leg up into my hand. Then I'm going to add on that you have to push your knee out towards my hand. And then I'm also going to push here, and you've got to try and turn your foot inwards. Okay, so start to bring up and out and rotate. So keep that there, keep it there, keep it there, and relax. Okay, next up is iliopsoas, so our strong hip flexor. So therefore we're going to bring it into hip flexion. So you just like to raise your leg up into this position here. You're going to go to the head end. Sorry if I fall a little bit out of shot, but your hand is going to go onto their shoulder, a nice straight locked arm against the knee here, whilst they try and pull their knee up towards them. Okay, so we're just going to stabilise and arm up here, and if you just raise your knee up into my hand, that's it, and then just keep going, go on, keep going, keep going, keep going, and just start to relax. Okay, next is our adductors. So 4 different positions here to differentiate. So we're going to first of all start off with flexed position. Feet together, so we've got consistency, and it's a slightly better positioning in terms of offering the resistance. Hand clenched fist, and the epicondyles are going to drop into these parts of your fist. Don't have your hand too high, because what can happen is they push, then your hand pops out. So you need to make sure you're nice and deep buried in there. So what I'd like you to do, Neil, is just start to squeeze up against my hand, and you'll feel if your hand's in the wrong position, because you already feel it starts to try and jump out. Make sure you clench your fist. If you don't clench, they'll crush your hand. Okay, and then just pull your knees together. Well, keep pulling, and relax. Okay, so this is more into the muscle belly. Then what we're going to do is we're going to take it a little bit wider. Elbow just below the medial epicondyle, hand and palm again, same thing, just below the epicondyle. You can just use your other hand just to make sure you're nice and steady with them. And again, just start to squeeze and squeeze, keep going, and relax. Okay, now next thing, we're just going to go nice and straight. And again, we're going to use fist. Again, fist in between the knees, in between the epicondyles, like I do now. So now we're coming further up towards the origin of the adductors. What I can do is squeeze your knees together in this position. You should feel that acting a little bit higher up. And relax. And the same thing now, just coming down the distal end between the malleoli. And again, if you just like to try and squeeze your feet together this time. Squeeze, 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 and relax. Okay. So a few more muscles to go. So we've got Gluteus, Medius, and Minimus. So we're going to turn them onto their side. If you turn them face that way for me. Make sure their head is nice and supported. We're then looking for a nice straight line. Just put your head up. Looking for a nice straight line from their head and neck all the way down through into their pelvis there. So you don't want them rolled, you don't want them flexing or extending. So nice and straight, and nice and square, not twisted. Next thing, they need a nice base of support, which is their underneath leg. Tends to be people put it a little bit too far forward and then they tend to start to roll. So just think a little bit more about bringing that slightly backwards. Okay. And for glute med and min, in terms of differentiating it from TFL, what we're going to do is with our TFL, just lift the leg up and straighten it out. So we want a nice straight line all the way up here, so just backwards slightly. That's it, and you're going to need to stabilise on their pelvis. You have me just placing my hand on the very top of your hip here, this portion. So nice and stable. So you can then control them, they're backwards and forwards. Make sure they're nice and stable. And just keep your leg in that position. So this would be our TFL as an abductor, but we want glute med and min back here. So to take out TFL, what we're going to do is bend the knee. Naturally what happens is this, the leg starts to come forward. Okay, so we just need to keep that slightly further back, stabilising here, and then on the knee I'm going to push down against your leg. I like to pull your leg up into my hand, just raise it up slightly. That's it, and then keep it there, keep going, and relax. Okay, so TFL is the next one, so just to repeat that, leg straight, so again, nice straight line here, same thing, supporting the pelvis, just below the knee this time. Again, keep them nice and square and just raise your leg up into my hand. That's it, and then keep it there, keep going, and relax. Just watch out for them twisting their leg this way. They start to try and use their iliopsoas as a hip flexor to trick the movement. Okay, last two is the hamstrings and the glute max. If we lay you on your front for me. So for hamstrings, different to the knee now because we're interested in how it works across the hip. So therefore what we're going to be doing is trying to activate the hamstrings partly as a knee flexor and then engaging that across the hip. So the way we do that, you just slightly unlock the knee, so it's just slightly flexed. We then ask that you also raise your leg up slightly, so it's coming towards extension. We need to stabilise back here again, making sure that you're getting your consent and you're placing your hand on here. And then you're going to come just below the knee to apply your pressure. Don't go too close, just lower third, or you can come slightly further down. Just watch out for gastroc engagement. I'm going to push down. I want you to try and raise your leg up into my hand. Okay, and just resist. Keep it there, keep it there, keep it there, and relax. Okay, it's a nice activation there of the hamstrings. Last one is our glute max. Same type of thing, but now what we do is we flex the knee to try and take out the hamstrings. So now they're so short, they can't really help with the extension movement. So then we get more activation of glute max. So then just raise your leg slightly off the bed. Hand just up in here, and again, stabilising on the back. And we're now going to make sure you use your body weight over the top. Okay, and then just pull your leg up into my hand, and resist, 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 and relax. Okay. Use your body to help you rather than I could have pushed this way, but it's just making it a lot harder work for me.